Hi everyone, my name is Laura Fisher. I am a health educator and I coordinate the Nicotine Prevention Alliance of Central Wisconsin. This alliance covers Marathon, Portage, and Wood counties. Today I'm going to be talking a little bit about pregnancy, infancy, and smoking and how that can affect both maternal and infant health during pregnancy and postpartum. Looking at the state of Wisconsin, in 2020, 8.4% of mothers in Wisconsin had smoked during pregnancy. As you can see, this has trended down since 2013, which is what we'd like to see, that consistent trend down. Looking a bit closer at our region, so the central Wisconsin region, maternal smoking rates in north central Wisconsin are higher than the Wisconsin rates. We can see that about 10% of pregnant people smoked throughout the state of Wisconsin in 2018. And looking at our central region, about 13% of pregnant people smoked in 2018. We see Marathon and Portage at 12%, and then Wood County is a bit higher at 18%. Looking towards the bottom of the slide, groups that disproportionately impacted by smoking rates, we can see that regional rate does make a difference. Wood County is higher than the other counties in central Wisconsin. This is mostly due to the rural geography of Wood County compared to Marathon and Portage. We can see that the Black and African American communities as well as the biracial or multiracial communities are highly impacted as well. Those that utilize Badger care are also affected at higher rates, and individuals that lived with a partner that smoked are significantly at higher risk. So looking at Portage County specifically, the graph on the left side of the screen, you can see that pregnant women have been fairly consistent with their smoking rates from 2011 to 2015, right about that 13% mark. In 2016, we saw that 20% of pregnant women reported to smoke during or up to 3 months prior to pregnancy. Similarly, in 2017, 17% of pregnant women reported to smoke during or up to 3 months prior to pregnancy. And these two values come from the annual report from the Portage County Health and Human Services. One thing to note with this is the detail that those that had reported to smoke 3 months prior to pregnancy were also included. So we can't necessarily juxtapose the 20 and the 17% with that 13% from 2011 and 2015. All health risks resulting from smoking during pregnancy are preventable, and this is what really drives our work. We know that smoking during pregnancy can have some serious consequences. It can lead to spontaneous abortion, stillbirth, preterm birth, low birth weight. After birth, there is high risk for sudden infant death syndrome, impaired brain development of the child, a higher risk for the child to experience asthma, and birth defects of the mouth, most often in the lips. Half of individuals who quit smoking during pregnancy will begin smoking again postpartum. So because of this, secondhand smoke exposure to the infant is of great concern. Secondhand smoke can cause the infant to experience more severe and frequent asthma attacks, upper respiratory infections, ear infections, bronchitis, pneumonia, and overall it impairs the lung growth throughout infancy. To the right of the screen, I have highlighted in the box that children of those who smoke are twice as likely to begin smoking than children that are not. And this risk is we see later on in life. Children develop that habit of smoking if they are living with a parent who smokes. Taking it one step further beyond secondhand smoke, thirdhand smoke is also a big concern. This information comes from the Third Hand Smoke Resource Center. Research has shown that 70 to 90% of nicotine and tobacco-specific lung carcinogens stay behind as residue in indoor spaces. Nicotine and these carcinogens can be embedded in carpets, cushions, drywall, and virtually any surface because it can land in dust. Researchers have also found that higher levels of hand nicotine were more likely to have had an infectious disease of bacterial diagnosis. And with this piece of information, what was done was children or infants that were hospitalized were swabbed, the palms of their hands were swabbed and tested for nicotine levels. And then those levels were compared to the diagnosis or reason they were brought to the hospital. I want to highlight one of the programs available across the state of Wisconsin, and that program is First Breath. This is a resource that uses the Ask, Advise, Refer model. So what they do at visits is they screen every individual at every visit about their tobacco use, and they use a motivational interviewing technique. So they use those open-ended questions to try to get to the root of the problem and avoid any simple yes or no answers to their questions. They want to get to the why, how much, and for how long. The next step is that they advise those individuals that may use tobacco that the best thing to do for their health and for their family's health is to quit. And this is that big education piece and where the prevention really comes to play. They educate about the mother's health, the infant's health, any other children in the home, and their partner. They then refer individuals for any additional support that they may be needed. So this data is shared by Lynn Frost, who is the Public Health Supervisor and Lactation Counselor for Portage County Health and Human Services, and they use First Breath referrals in this prenatal care coordination. So in 2019, they had 86 prenatal assessments, and 19.8% of those individuals had reported to smoke during pregnancy. We can see that in 2020, the percentage of those that smoked during pregnancy significantly increased. And of course, we have to keep an asterisk next to this. The pandemic certainly was a huge factor across all health behaviors during this time. In 2020, they saw that only about 25% of those individuals had reported to smoke during pregnancy. Across the board, they had high percentages of referral rates. In 2019, they had 95.8% of those who were referred had enrolled, and in 2020, about 93% had enrolled. And there was no data at this time available from 2021. So looking closer at the total number of births in Portage County, in 2013 to 2014, 173 women had reported to use tobacco during pregnancy. 120 of them reported to use intermittently or throughout their entire pregnancy. 79 individuals had quit prior to their pregnancy, and 53 had quit during the first or the second trimester. So these numbers, we have seen a steady decrease throughout the years. In 2019 through 2020, the data reported that 113 individuals had used tobacco during pregnancy. 86 of those individuals had used intermittently or throughout their entire pregnancy. 55 had quit prior to pregnancy, and 27 had quit during their first or second trimester. So although numbers seem to be trending in the right direction, we're seeing less mothers smoke or use tobacco products throughout their pregnancy. There are still concerns for the future. As products evolve, one of the biggest concerns is these nicotine products. Although they don't contain the harmful tobacco chemicals, they still contain that harmful nicotine piece among any other chemicals that may be involved. So these products, known as smokeless tobacco products or smokeless nicotine products, are gaining in popularity. We have seen brands like Zyn or On is another popular brand gained significant popularity throughout the pandemic. These products, as I mentioned, contain high levels of nicotine. And because these products aren't regulated, they tend to have higher levels of nicotine than we would see cigarettes or even traditional commercial chewing tobacco. Another piece that we know is that using these nicotine products, smokeless products specifically, can lead to the use of commercial cigarettes or other tobacco products down the road. If you have any more questions about this or would like to talk more about different resources or cessation services, you can certainly reach out to me using my information on the screen. Thank you.